Can you guys see this at all? I'm going to pass it around. And this one is Juvederm, and this one is a hyaluronic acid filler. And I want you all to take a look at this. And if you look at it, if you were to open it up and squeeze it out, it's really like a jelly-like material. It's a naturally occurring product in our skin. And the difference between this one and some of the other hyaluronic acid fillers is basically how it's bound together, or the connections that hold it together. So with Juvederm, it has more attachments holding the molecules together. So because of this, what they have to do is they actually have to add some unbound hyaluronic acid. Think of it as a lubricating acid to help, or a lubricant that's added to the product to help push it out. Because with all those cross links, they mix it in a blender to make it easier to push out, and then they also will add this lubricant so it will mush out. So that's one of the products. Then we have Juvederm Ultra Plus, and this one looks the same way. It looks like a jelly-like material, and with this one, it's just bigger globules. So that's what makes this one a little bit different. The idea with that one is that it will last just a little bit longer in the skin. Then we have Voluma, which is the newest Allergan product for fillers. And with this one, they have a different cross-linking mechanism, which makes this one last for about 2 years. So next we have Restylane, and Restylane again looks just like a clear jelly. And this clear jelly is found naturally occurring in our skin, and a couple areas where it's found naturally occurring are in our joints and in our actual skin itself, and that's in the dermis. The difference with this one is that it's less highly cross-linked. But in this case, it's good because this one mirrors the hyaluronic acid that we have in our skin. So the amount of cross-links that we have in the hyaluronic acid in our skin mirrors this one. And so this is probably one of my favorite ones. And the reason that I like this one a lot is because it's not as strong of a humectant. And what that means is it doesn't attract water quite as aggressively. And you know, that's the reason you can use this one around the eyes and you can't use the Juvederm around the eyes, because of the attraction of water, it'll make things swell. And around your eyes, if you have swelling, it looks like you have a sinus allergy, or you're tired, or you've been partying too hard, right? So we don't want that. And then with the next product we have is we have Perlane. And this is the sister product to the Restylane. The difference between this one and Restylane is that when they make Restylane, this one they don't have to put in a blender to swirl like they do the Juvederm. This one, what they do is it's like a tray of Jello, and they cut it into little cubes and actually push it through a mesh, which makes it into tiny little cubes. But with the Perlane, instead of having tiny little cubes, they're just a little bit bigger cube. And with this, the idea is it lasts a little bit longer, perhaps, and it gives you a little bit more bulk and volume. So if you guys have questions about this when we're talking about it, let me know. Okay, next we have Silicone, and this is a permanent filler. This was recently FDA approved, but the idea of silicone, or the use of silicone, has been around for a long time. Does anybody remember the breast augmentation issue where they were putting silicone in the body? And does anybody know what they were saying about it? They thought it caused connective tissue diseases like lupus and mixed connective tissue disease and all that stuff. So there was a huge lawsuit with this product. Excuse me. But it was not this product because they never had an FDA-approved form of silicone. But what they found in the research was it really was not causing these mixed connective tissue diseases to occur. But Dow Jones, who was the manufacturer of the silicone that they were using, just paid them off just to get rid of that lawsuit. Well, this is an FDA-approved form of silicone that came around in about 2001. And the nice thing about this one is we know it's purified, because when you look on the internet, you'll see horrible things attached to silicone and what it can do to you. They'll say it can cause red lumps and bumps underneath the skin, it can cause huge nodules underneath the skin, your body can reject it. Well, with this purified form of silicone, it's considered biologically inert. And what that means is that the body should not react to it, number one. Number two, the nodules that form were from injecting huge volumes into one location. And so with the technique that we use now, what we do is we put tiny little drops underneath the skin. And with those tiny little drops, what happens is the body forms a little wall around it, and like a cocoon, and it holds it into place. So now this is great. This is a great product, and you see very, very, very few reports of this causing bad reactions in people's skin. Now, when you see the reactions, you'll still see, oh, this person had silicone and their face looks horrible. Like Priscilla Presley is one, and then, I mean, she's the one that's come out to publicly admit it. I think maybe Suzanne Summers has had it in her skin as well. But when you see these people, it wasn't injected the way we inject it now with the tiny little drops, number one. And number two, it might not be the purified form of silicone that's FDA approved. So this is a great product. When we see our patients, we have patients that come in all the time that look horrible. They look really puffy, they look unnatural, they look fake, their lips are horrible, they have, this fullness here that pulls their cheeks down and they look jelly. Silicone is not that bad, it's just if it's injected improperly, that's when it causes problems. So I want you just to swirl this one and you'll see it's just like a little liquid. Instead of being jello, like jello and the others. This will pass over. So, next thing we have Radius. And this one is different. It's not made from hyaluronic acid or silicone. It's made from calcium hydroxyapatite. And what this is it's basically like ground up bone or ground up teeth. And it comes in a powder form. And when you inject it, they say it's bioactive and it stimulates your body's natural collagen. Whether this occurs or not, I'm not totally sure. I like this product because it does last a little bit longer. Initially, we said it would last 2 years or longer. Now we say it lasts about a year. Okay. The problem with this product that I see is it's very viscous and very thick, and so when I'm injecting, I like to pull back to make sure that I'm not in a blood vessel. And with this product, when you pull back, it doesn't aspirate, and you can't see if you've gotten into a blood vessel or not. That's the only problem I see with this. So it's a nice product, but it's not really my favorite. The other thing is you can't use this product underneath the eyes or around the mouth because it can bunch and lead to lumps underneath the skin. Okay, so now we're up to Sculptor. And Sculptor comes in this little vial like this. And if you look at the vial, this is one where it comes as a powder form. Okay, and so with this powder, what we have to do is we have to mix it. And so you add a little bit of lidocaine so it's not painful when we inject it, and we add a little bit of water. Now, initially this product, one of the main complications that you can see with this is it can lead to lumps underneath the skin. And I've had those lumps in my neck, and I've had them underneath my eyes, and these were the best injectors in the country. This was early on. And the reason for that was that they weren't, a couple reasons. First of all, they weren't mixing it with enough water, number one. Number two, they weren't letting it soak in. So you have to let this soak in overnight. And what that does is it helps to dissolve the particles of Sculptor here. And the other things that we do now to minimize the risk of getting those lumps, in your skin, are to heat it and to let it soak in overnight. Now, this product was initially developed for people with HIV, and it was a fast-track drug because people that were suffering from HIV lipodystrophy carried the stigma of having AIDS. And when you saw them, I don't know, do you guys remember when you could see people with HIV? Yeah. Does anybody know? Do you still see it?
In stages.
In stages, but not as much. And the reason for that, I believe, is that everybody's been filled. That's what I think. And the other thing is that the new drugs, the new medications that are out there don't lead to lipodystrophy as much. So initially it was fast-tracked for that, and then they got the FDA approval for cosmetic indications. Now, what makes this unique is this is basically, the others are like silicone, hyaluronic acid, and calcium hydroxyapatite. With this one, it's basically just a sugar. And so it's ground up suture material. And so this is absorbable over time. What it does is it gets into the skin and it stimulates collagen to form. And so what you're getting is bioactive material that's going to produce natural collagen. So that's what's really great about this product. It's a 2-year filler. They say it lasts for 2 years. And again, the only thing that is really the big side effect to me is the fact that it can create the nodules underneath your skin. When you get those nodules, you can massage them out, but we really have minimized that risk now with the techniques we discussed earlier. And then the other thing that some people don't like is it takes time for it to actually happen in your skin. So the collagen development doesn't happen overnight. It takes a few months for that to be stimulated. So great product. And the thing that I love about this product for me is the fact that you can use it in the lateral parts of the face. I think the Restylane is great for the central part of the face, and the Radius is great for the central part. But But I like it for along the jawline here because it creates a softer, smoother look here. Because I think this is one of the most neglected areas in the face is this area here. Because what you'll see is when this deflates, people start to get this jowling here as it deflates, and it also creates a skin on bone or muscle on bone look in older people, especially if they're thin. So great product, and that's all I have for you today.